Are you a barbell or CrossFit athlete dealing with pain on the front of your shoulder when lifting overhead? Hi, I'm Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab, where I've helped countless barbell and CrossFit athletes get back to lifting pain-free and at peak performance. I want to talk to you guys today about a common pathology and injury that I see in the clinic, especially in CrossFit and barbell athletes, and that is the long head of the biceps tendinopathy. So what is the long head of the bicep? So when we look at the overall anatomy structure there, we have the bicep, which is, we all know the bicep, the big muscle in the front of our arm here. But that bicep, as it's going up towards the shoulder, it splits off into two different heads. You have one that splits off towards your chest, which is your short head of your bicep, and then you have one that goes straight up the front of your shoulder up to the top of your labrum, which is the long head of the bicep, and it runs right in this bicipital groove, which you can feel right on the front of your shoulder. And that's a lot of times how I will identify if that is the structure at play. Is I will get on that tendon and I'll palpate it, and I'll almost like kind of like flip back and forth over it. And in people that have a cranky bicep tendon, once you do that, they will be like, yes, that is painful. But the second thing I'll ask is, hey, is that where you're feeling your pain when you are lifting? And that's when they typically will say, yes, that's where I feel pain when I'm lifting, or no, and then we may have to dive into a couple different areas. Now, when we're talking about tendons, a common distinction that I want to talk about is tendinitis versus a tendinopathy. Almost always, when someone goes to a doctor and they have a tendon issue, they get diagnosed as tendinitis, whether they've been dealing with it for 2 days or 2 months to 2 years. Now, the important distinction here is that with tendinitis, that last part of itis indicates an inflammatory process, and that is really only present, the inflammatory process is really only present for about 2 days after the tendon issue, before the tendon becomes painful. After that, in these chronic issues, it's much more accurate to call them a tendinopathy, specifically a tendinosis, where there is some type of degenerative changes in that tendon. So instead of a nice smooth tendon like so that can withstand force, the tendinosis, you get a lot more of this haphazard, imperfect laying down of that tendon, so it can't withstand stress as well. Now, why do tendon issues happen? More often than not is because the capacity of that tendon to withstand and accept load and force is essentially overloaded over a period of time versus in one specific instant. Now, you might feel it at one specific lift, but it was probably an issue that has been brewing for a while. So going into the examination, again, we talked before about palpating on that bicipital groove. That will be a big indicator for us if we're looking at the bicep tendon or other areas. We'll also look at range of motion. Typically, people with a cranky bicep tendon, they will get pain when their arm is straight out to the side during this arc here, or they will get it a little bit like a pinching sensation right at the top of that shoulder blade. What I'll do then for both of those movements is I will be standing behind them and I will move their scapula, their shoulder blade for them, because I'm looking to see if, hey, if we get the shoulder blade to move in the direction we want to, does that improve symptoms? And a lot of times in these cases, you'll do that I'll help their shoulder blade out, they get to the top, and their symptoms are immediately cleared up. And that indicates to us that there is likely a scapular instability or weakness cause that is at play, resulting in this bicep tendon issue. So that brings us into our treatment. In a lot of cases, we'll focus on three different areas for the shoulder. So we'll focus on one, scapular stability. And again, the scapula is your shoulder blade. Your shoulder blade is quite literally the shelf that your entire shoulder will move off of and be stable from that standpoint as you're moving overhead. Now, when we look at how important the shoulder blade and the scapula is, a perfect example is if you have a weak shelf and you put a lot of stuff on it, it's going to come crumbling down. Now, that's a very bit of a drastic way to look at it. Your shoulder's not going to crumble down, but it ultimately just means you're going to put more stress on certain areas than you would on others. So we might do there's a couple different exercises we might do to target the lower trapezius and the serratus anterior, which are two of our big scapular stabilizers, especially when we are in an overhead position, so we don't have to necessarily use that upper trap and that neck a lot to compensate. The second part of that is thoracic spine mobility. So this is your mid-spine. And that mid-spine, when you're lifting overhead, it needs to extend, and it also needs to have a little bit of rotation as well. When we are limited in those two areas, again, what's going to happen is you're going to force movement more through the front of your shoulder, which in other words is going to load your bicep more than it normally would. So there's a lot of thoracic mobility involved in our rehab programs for long-headed bicep tendinopathy. The last part, and it's not as much of a priority as it is for scapular stability, but I always like to have some type of rotator cuff strengthening in there. I've seen some cases where people have bicep issues and they have a really strong rotator cuff, but I've also seen others where they have a really weak rotator cuff. So we generally will have that be a little bit of a guiding factor on our plan, but more more often than not, scapular stability and thoracic spine are going to be the big ones, and we will incorporate some rotator cuff strengthening in there at times for the posterior cuff and a little bit of the anterior as well for that subscap. So if you're a lifter that is dealing with pain on the front of your shoulder, and it's getting to the point where you really just can't lift or press overhead or even do a pull-up, kipping work or anything like that without pain on the front of your shoulder, go ahead, leave a comment below with any questions that you have, like and subscribe to this, or leave another comment with any questions that you have or more content that you're looking for.